Lie on your back now. You're going to be on this panel right here. So we have Christine here today. What do you want to work on?
Basic, my whole right side, my hips, lower back, maybe my knee
Okay.
and foot.
All right. And which knee is it?
This
Right knee. Okay. So I'm going to have you start face down. You're going to put your nose right in here. And scoot down towards me a little bit. Even more, a little more. Put your nose down and put your arms alongside your body. Good. You said you're the right side. You feel it, right?
And you know what? When I'm laying down, my middle sacrum area hurts.
Yeah. So through here.
I really lay down like this. That's why.
Because it's hard to lay on your belly?
Yeah.
Lift this thigh up in the air and put it back down. And then lift this thigh up in the air and put it back down. Which one's harder to lift? And when you lift it, do you feel it in here or higher up?
Right in here.
All right. So lift it again and see if you could point to the one spot it hurts the most.
Actually, it's right here.
Okay. Good. So drop that leg down. So one thing I want to just take a quick picture of is how off your hips are.
Mm-hmm.
So I'm going to, they're not a little off, they're a lot off.
They are, right?
Yeah. So really massively misaligned. I'm going to push into the pelvis. You have what's called a PI ilium on the right, which means it went posterior and inferior. Another technique that I've studied called the activator method calls it a pelvic deficiency on the right. But I want to do one other spot. I feel right there. Yeah, that was a good spot. And now the legs are even. Come in really close so you can see that with the camera. Good. So now lift this leg. See if it's starting to ease up a little bit.
Yeah, you know why I feel this now? My
Good.
hamstring.
Okay. Good. That's okay because the hamstring helped lift it, but you're feeling it less dysfunctionally in the SI joint. Let's do the next thing, okay? Mm-hmm. Next thing is we're going to internally rotate the hip by me rolling the leg out like this. And that threw it off also. So you have an internally rotated femur, head of the femur, and it's also moved the pelvis a little forward at that part of it. Let's come back now and look again. Much better. I'm going to fan the knee out. One more. There we go. All right, you said it's, which knee is it? The right. Everything's on the right.
Mm-hmm. I have to get all started from that point.
So I'm going to adjust the knee a little bit right here, but it's really not the knee, it's the top of the tibia, which is the shin bone. So it's the very top of the shin bone went forward. And now I'm going to check rotation. I'm going to check valgus and varus stress. I'm going to check the fibula. The fibula feels really tight though. Do you feel how it's so tight right here?
I have extremely tight IT band.
Yeah, so, okay. Good. Right in there, you feel?
Oh, yeah.
That hurts a lot, right?
Yes.
Good. So I did a little something for the knee. You'll have to let me know how that is. Maybe you can send me a text or a DM when you
Definitely.
test it out a little bit. Take a big breath in and blow it out. It already, there it is.
Mm-hmm.
Lie on your back now. You're going to be on this panel right here. Turn your face all the way to this side. Now come to the center of the table. Hands on your belly. Lie on your side facing me. Hold my hand. Come to the other side. Got it. Lie on your back. Scoot down towards your feet so your heels hang off. A little more, perfect.
I cracked it by the touch.
Okay. Come stand and see how you feel. Stand on that side.
Yeah, it feels a little looser here.
Yeah.
I felt it. Yeah.
How's your knee feel? Moving around a little bit.
Actually, it doesn't. It feels pretty good.
All right, good.
Mm-hmm.
All right.
Thanks.
You're welcome. Thank you.
Thank you.